Hydroflux, Redefining Your Lifestyle presents the return of the Singapore Parenting Festival. Join our amazing hosts in a series of 8 free webinars that cover fertility and pregnancy concerns, parenting tips for newborns to fussy eaters, living with COVID and vaccinations, and guides from preschool to PSLE. Register now and attend our webinars for your chance to get an exclusive SPF goodie bag while stocks last. The Singapore Parenting Festival is proudly brought to you by MediaCorp and the Asian Parent. Platinum Partner, 100% organic drip chicken essence with cordyceps. Gold Partners, Dumix Dugrow, comprehensive nutrients. Scott's Vitamin C for kids' immunity. Nature One Dairy, your partner in parenthood. PCF Sparkle Tots, we sparkle lives. And the following silver and other partners.
All right. Thank you so much, everybody, for joining us this evening. It is Tuesday, like literally 2. So happy Tuesday, everybody. And thank you again for registering and showing up for this evening's webinar together with myself and a panel of very well-known and expert speakers tonight, right? So I do want to also thank MediaCorp and the Asian Parent for organizing this yet again exciting Singapore Parenting Festival that I was also a part of last year, and this year's lineup of the topics are also very, very interesting. So I hope that you guys have also signed up for the upcoming later webinars that are happening as well, or as part of this festival. So today's topic that we are covering is New Mom's Guidebook, the key essentials, right? Now, I want to remind you guys as well, please have your phones on standby, your QR code scanners as well, because there will be an opportunity for you, actually a couple of opportunities for you to use the QR code and get a couple of freebies and yeah, walk away and tell your friends as well, all right? And walk away with some goodie bags as part of this festival, right? So once before we begin, I would actually like to thank MediaCorp and Asia Parent once again, as well as the Platinum Partners, Hydroflux, Yirensen, the Gold Partners, Dumex, Scott's, PCF Sparkle Tots, Nature One Dairy, and the Silver Partners, Ministry of Health, Singapore, Baby Dove, Virtus Fertility Center, Prudential, and the Content Partners, Center for Fathering, Mums for Life, Dads for Life, and Baby Pass, right? So thank you so much for making this event, this festival once again possible. Now, before we move on, all right, I want to remind you guys again that there are contests, there are webinars, there are grand sales that are happening as part of this festival. So please do not miss out. Starting off with a couple of house rules that we want to have you guys be mindful of. So do know that there is a Q&A section at the end of today's webinar. So do put in the questions, the burning questions that you have into the Q&A tab, not the chat box, but the Q&A tab, right? That is where we'll be pulling out your questions and the panelists will be discussing it or answering your questions at the end of today's webinars, right? So please, questions are very welcome. Please put them into the correct box. That is the Q&A tab, right? There will also be 6 lucky winners as part of this this evening's webinar who will walk away with a $50 Shopee voucher each with no minimum spend though, all right? So please try and hand at it, and how you stand a chance to win that is just stay till the end, because that's where we announce the winner. So if you're not here, you don't get it, all right? So tell your friends about it as well, okay? They will stand a chance if their names are still in the attendee list, if they registered and their names are in the attendee list at the end of the webinar. So winners will be announced at the end, all right? Stay tuned. There's also a QR code that you see right here. So please scan it and take part in the Spin the Wheel contest where you can win attractive prizes every day, right? Maybe take a picture as well every day, right? Okay, so just pull it out, scan it the next day as well, all right? So those are the house rules that we want you to know. And do also make sure that you're, for the winners, okay, you have to be here at the end now, right? Otherwise, and there's also a key thing for you to take note of. So pay attention, right? If you are one of the 6 lucky winners, right? So there are goodie bags as well that are up for grabs. And the first 150 attendees who scan it, okay, are going to be able to win this exclusive goodie bag as part of the Singapore Parenting Festival as well. So like I said, keep your phones close by, because you will be able to scan and actually bring home these goodie bags, right? So a little bit about myself. I've been talking for a while now. I'm Dawn Sim. I'm a mother of 4. I own a couple of businesses, and I'm also very active on social media as an influencer. So you can find me on Instagram and Facebook. I'm actually known as that mom of 4, right? So those are my 4 kids. Well, the 2 older ones are actually way taller right now. Okay, and then my 3rd kid is still the same size. So that's me and my husband. And yeah, so you might hear them lurking around on and off, right? So enough about me. We also have, like I said, a panel of experts who will be answering your questions and sharing, about the topic that we have today. They're very experienced. Okay, so please put your questions in for our experts into the Q&A box. Firstly, we have Dr. Damien Keogh, who is the CEO and director at BluMaiden Biosciences. So this is a data-driven and innovative, he is a data-driven and innovative scientist with a background in biotechnology, commercialization, and entrepreneurship. So with all these accreditations under his belt, he's able to answer a lot of the complex questions that you might have about microbiomes. So he does work with a specialty in health and the cause of disease, with the special focus on the influence that the microbiome, which are the bugs, the bacteria in our gut, right, and how they affect us, right? So he's also a parent. He's got a 4.5-year-old boy, right? So yeah, if you have any questions with relation to, I guess, kids as well, not just adults, you can actually put it out into the Q&A box for Dr. Damien as well. All right, and up next we have Sister Lilian Pong. We meet again, all right? She is a lactation and parent craft consultant, a state certified midwife with over 56 years of clinical experience. So she was with KK Women's and Children's Hospital for 48 years and has worked both in the maternity ward as well as the women's A&E department. She's very, very experienced, all right? And today she actually manages her own premier parent craft consultancy and continues her passion in providing top quality postnatal care to all mothers, right? So motherhood shouldn't be difficult. Sister Lilian Pong will be able to give you the advice and encourage you to just enjoy motherhood as it should be, right? So lastly, we also have physician Eric. All right, so Physician Tan is a TCM expert with Yirensen, who is one of the platinum partners for the Singapore Parenting Festival. And he graduated from the Beijing University of Chinese Medicine. And with all these accreditations that you see right here, he's very experienced when it comes to TCM. So he's actually the expert for Yirensen Singapore and acts as their consultant for their products and supplement development. And he also imparts TCM knowledge to their staff as well as the public through trainings and courses, right? So that's the panel of experts that we have right there. Okay, and when with our TCM expert, please make sure that you're also asking the questions that you have with relation to, like, supplements, I guess, with food related to how it can help you, to live a lot better. All right, put it out in the Q&A box as well. All right, so I'm really looking forward to the sharing from our experts also. And with that, let's move on to our very first poll. You've heard me talk so much, time for me to rest again a little bit because we want to hear from you. Okay, so tell us, just click on the right answer here in the poll box. Please don't put the answer in the chat box, put it in, just click in the poll box, right? Tell us which trimester you are in right now. So trimester 1, trimester 2, trimester 3, or you are in the midst of trying to conceive, right? So 1 out of the 4, let's see out of our attendees this evening, at which stage are you in right now? Okay, so, okay, 39%, which is the majority of you, are in trimester 2. Congratulations. All right, and then followed by trimester 3. Whoa. And then trimester 1 with 15%, right? And then 18% of you are trying to conceive. So the majority of you are actually expecting. Congrats to all you ladies out here, okay? And I guess some of you daddies or daddies to be as well, right? So thank you so much for sharing with us your answers. We will have another poll coming up as well. So again, share your answers with us later on. We want to hear from you as well, right? So let's move on right now, okay, to have our first speaker come share with us. So like I said, the topic that we have, all right, with Dr. Damien, all right, has got to do with microbiome, but it's actually very interesting. It's not just about the bacteria, it's how it affects, the young and old, right? So over to you, Dr. Damien.
That's right. Thank you so much, Dawn. That's a really wonderful introduction. So yeah, today I want to speak about pregnancy health and how this relates to your family's microbiome. And really the background to this is my wife's own pregnancy journey. So she's really the inspiration for me to work on this particular topic. And I know how meaningful it is to all new mothers and new families. So every parent really wants the best for their baby. And caring for your baby really starts quite early, even before birth. So a healthy gut in early childhood can actually improve the chance of a healthy life by reducing disease risk. So if we go to the next slide. So everyone actually knows what the microbiome is, even if the name's a little bit off-putting. It's essentially the bacteria that live inside your tummy. So there's millions and trillions of bacteria, viruses, and fungi that live inside of you. And actually they're really part of you. They're part of you as a person. And they're there right from the moment that you're born. So when your mother actually delivers you into the world, you receive a dose of microbiome from her. And this is really essential for your human development, for building up your immune system, and for dealing with nutrition as you grow. So without the microbiome, we would not be a healthy individual. So it's very important that we pass on good microbiome and good health to our children. So there's a lot of really interesting things about the microbiome as a scientist, but to kind of make it relevant for everyone, I've put together this slide just to put it in context. So the microbiome, it's not just inside your gut, it's not in your tummy only. It's actually on your skin, it's in your saliva, it's in your breast milk that you feed to your baby, it's in the birth canal when you're giving birth to the baby. And typically, if you're a healthy individual and you live a healthy life, you have a pretty good microbiome. A lot of things can influence it, so you can actually get sick, and then the microbiome becomes different. And this has an association with certain diseases. So here I've listed a few diseases that are relevant to this conversation today. So diseases like gestational diabetes or breast cancer, IBS, pediatric obesity. All of these have some sort of a connection or an association with the bacteria and the microbes that live inside of you. So it's really, really important to understand what's going on and to really factor this into the way you live your life. So if we move to the next slide. So in order to really highlight this and show you the power of the microbiome and why it's so important to really appreciate this, I'm highlighting this disease called gestational diabetes. So in Singapore, it's a really important disease because, not to alarm anybody, but 1 in 4 pregnancies in Singapore encounter gestational diabetes. And if you get gestational diabetes, you really need to manage it very carefully. You need to take a lot of advice from your doctor. And typically this is in your final trimester. So there's a lot of sort of negative outcomes in the pregnancy for both the mother and the child if it's not managed appropriately. So it's really critical that we identify who's at risk of this. And luckily, your doctor actually has a diagnosis that he or she can perform at the end of trimester 2. This is a blood glucose test. But there's a lot of opportunity to look at the microbiome as a readout to actually understand it and get a prediction on this particular disease. So if we go to the next slide. So how can you best actually pass on or give an inheritance of microbiome to your child? Well, there's 3 kind of major mechanisms. One is by the way you deliver. So whether it's a natural birth or a C-section, it's a very different type of microbiome that's passed on. When you're actually breastfeeding your child, you're directly feeding a microbiome into your baby's gut, which can be very, very positive. And actually, very importantly, the environment that your baby lives in. So the parents, the additional parents, so it could be the father or the grandparents, for example, if they're interacting with the child, actually what they're doing is shedding and passing microbiome onto the baby. And this is a very positive thing because you're essentially teaching the baby how to build a microbiome and to grow this natural microbiome.
Wow, this is really interesting, Dr. Damien. Can I just ask a little something that you talked about earlier? You said that this microbiome is also on our skin, so it's a good thing, right? But what about for people who are exfoliating their skin? They love using exfoliants and scrubbing off the dead skin frequently. Does that have an effect on the microbiome?
It does. So everything has an effect on the microbiome. Everything you do, whether you wash or if you don't wash, you have an effect on the microbiome. And actually, the cosmetic industry have put a huge amount of investment into learning about the skin microbiome and how those products actually affect the microbiome. So that's why you actually pay for a little bit more expensive products, actually, because typically they're trying to keep a good healthy balance in the microbiome and keep the pH of the skin quite stable. So that's yeah, definitely there is an effect, and that also has an effect on the baby too. So how you bathe your baby, which I think some of our other panelists might speak about later as well.
Yeah, very good point. And then just one more thing about your slide right here. You said the delivery mode, natural versus C-section. Mm-hmm. So what's the difference? Because personally, I gave birth via C-section 4 times. So I never had my babies coming out through the natural birth canal. What's the difference? You know, is there any way? Am I missing? Is my child missing out, or my children missing out? On the microbiome?
Yeah, this is always a common question, actually. So I think first and foremost, I should say not that people should not be alarmed by this. When people give birth, it's quite already a stressful period of time, and you've got a lot to focus on, and really the attention should be focused on the baby and that. So don't be alarmed and follow your pediatrician's advice, I think is the first thing I should say. But there is a difference. There's been a lot of research, a lot of clinical studies that have shown a difference between natural birth and C-section. And there is a longer term effect for the individual that's born by those mechanisms. How can you change that? Well, this is the sort of work that I do and the work that we try and do with Baby Pass. We try and actually look at giving more information about the microbiome and how do you manage a healthy lifestyle. So how do you eat naturally? How do you implement a good regime? And give you actually data and insights to your microbiome to try and support you along that journey. And everything we do is we're not trying to substitute for a medical doctor. We try and work with the medical community.
Awesome. Thank you, Dr. Damien.
No problem. So, okay. So going back to gestational diabetes and pregnancy health, so what we have done really is we've looked at what's already been published. So there's actually been 4 really important clinical studies that have been published around the world. Actually, 2 of them were done in China, so Asian population, and 2 of them were done in Europe. And while this is a little bit of a heavy slide, it's got a lot of information here. What it's saying is that 600 pregnant mothers actually participated in these studies. And the information that the scientists gathered from this study was that there's a signature in the microbiome of the mother during trimester 1 that gives a signal to say that those individuals are at risk of developing gestational diabetes. So this is publicly available information, it's published studies, and it highlights just how critical and how useful the microbiome is for helping to understand disease and helping to actually alleviate or to avoid or predict diseases.
Mm-hmm.
Yeah. So the microbiome is really a powerful tool. And we can move on to the next slide.
I wish I knew about this earlier, Dr. Damien, because I actually had gestational diabetes when I had my first child.
Oh, really? Oh, wow. Well, now we have this intervention and this this sort of research, like research in biotech has really tremendously advanced our ability to deal with diseases. And this is just one example. So here in this illustration, you can see the typical pregnancy journey. And as I mentioned earlier, the blood glucose test for gestational diabetes happens at the end of trimester 2. But if this microbiome signature test was available, which it is, then you would be able to detect and predict whether the person's at risk of gestational diabetes much, much earlier. And the advantage here is that it's obviously less stressful to get this information earlier in your pregnancy. You've got more time to actually do something about it. And to be honest, the typical intervention that a medical doctor would prescribe would predominantly be lifestyle change, dietary change, and behavioral changes. There are some other more, drug interventions it can be used if it's really needed, but the preference is to go with the lifestyle and dietary change. Okay, and the next slide.
All right, so this is the clinical study.
That's right.
Yeah. So this is with Baby Pass. You're actually conducting a Singapore in Singapore locally a clinical study to recruit up to 600 pregnant moms in their first trimester, right? So this will help you to understand the drivers of pregnancy complications and then potentially open the way to new therapies for people who need that. So the purpose of this study being done is to help collect health data and the stool samples from pregnant moms during pregnancy so they can better understand the link between gut microorganisms, right, and the pregnancy health, because these bacteria are found in the gut too. So that's where you need to get it from. And who can participate? It's pregnant women who are less than 13 weeks in their pregnancy during gestation, right, and age between 21 to 40 years old. So the time and commitment is 1 stool sample and 2 questionnaires. I think the result that you get at the end of it, not knowing is only going to cause you worry as well. Like what happened to me, I only knew it much later. But if you can have that answer much earlier and then prevent this sort of thing from happening, because it doesn't just affect you, it actually affects your baby quite a fair bit, right? So I was really worried about how it would affect my firstborn. I mean, she's okay now, but the thing is, anything can happen, right? So us having the answers, through the study, and they don't have to pay for this study, right, Dr. Damien?
That's right. No, actually, there's no fee for the study, and actually the participants get a reimbursement. So we reimburse you, and you also get a microbiome report to tell you what's inside your gut and how that relates to you.
Yeah, so, I think that's really amazing, because you get like what Dr. Damien said, you get the test results, you get something out of the way you don't have to worry about. And this study, actually, we just want to put it out there, it's not endorsed or affiliated with the Singapore Parenting Festival, MediaCorp, or the Asian Parent, but it's a study where you can actually help future mummies to be and people down the line to be able to understand a lot more about this condition. So it'll be for a very good cause. So thank you so much for doing that, Dr. Damien.
No, thank you. Thanks to everyone.
All right, so do sign up with the link that you see right here. Scan it, and you can actually register to take part in this clinical study. Right, so hope you guys will be able to support this study that is done just for local moms in Singapore. Right, so all right, thank you. So let's move on now. Thank you again, Dr. Damien. We're going to move on now to your pregnancy journey with prenatal care and diet, together with our very dear Sister Lilian. So over to you, Sister Lilian.
Thank you, Dawn. All right. Welcome all you mommies and daddies. I know you are all on the journey down in pregnancy, anxious to know what to do and how to manage. All right, looking forward towards that baby. But before we go on to the other parts of the journey, let's talk about your prenatal care and diet first. Every time when we talk about prenatal care, mommy, it will be good for you moms, if you're first time mommies and daddies, to sign up for a prenatal class. All right, when you sign up for a prenatal class, there are lots of things that you will learn from the class. You will be guided on exercises to relieve any body changes, because your baby will be in you for anything 37 to 40 weeks. So you go through a journey of body changes, mommies. You will have all your pains, aches, body stretching that you never had that before. So when you attend a prenatal class, for instance, you'll be guided on the exercises to do so that you can prevent all the pains, or should it arrive, you know how to manage it. It will also prepare you for your labor. The labor breathing and the art of breathing is totally different from our ordinary breathing, because you're making sure that you breathe well as your body expands, especially after the 24 weeks rather, sorry. And then daddy will be with you to cope up with your journey down. Today's mommies are very lucky. Daddies will travel the long journey with them, all right? Your breathing exercises for labor will come in. I always tell moms this, when you're pushing out the baby, daddies, you look at mommy's face, she's like pushing out a tractor. Okay, so if you know how to breathe in, hold your breath, and practice all this prenatally, when it comes to labor, you are all prepared. All right, all your breathing techniques with daddy's support. Now, with that also will come also your breastfeeding. And your breastfeeding, you will also learn about how to prepare yourself for breastfeed by taking the right diet. Mummies, when you're pregnant, you're not eating for two. Don't forget, if you're eating for two, by the time you're in the second trimester, you're overweight. Mummies, today, you are blessed. You are allowed and encouraged that you can take as much, you can go as much as 12 kg weight gain throughout that pregnancy, max. All right, don't go beyond that. Otherwise, you will get gestational diabetes. When I first joined nursing, all moms at international level, all the world around, are told that maximum weight gain is 10 kg. But today we allow right to 12 kg. Why? Part-time hobby is also eating. So there must be a cap to it, nah, mummies? So what then do you think of your diet? Mummy, don't forget, concentrate on a high protein diet because your body go through body changes. You go through wear and tear. It has never been stretched. Your womb, which was the size a little bigger than the fist, is now stretched to accommodate that growing baby. So you need to take a high protein diet. In doing so, you are actually nourishing your body as well as the growing baby, because when baby is in the womb, baby extracts everything from the placenta, which is attached to mommy's womb. So a high protein diet. Now, sometimes in prenatal, we do hear of certain things that you're advised not to eat. Not to eat. It's too cooling for mummies prenatally. All right. Especially Asian moms, they are guided not to eat too much fruits. And one of the common complaints is constipation in pregnancy. That's how hemorrhoids and piles come in.
Not surprising.
So you need to have fruits and vegetables. Vegetables are never too cooling. Fruits, even local fruits, bananas, papayas, all these are fine. They are never too cooling. Even imported fruits from Western countries, from Europe, all those that have the 4 seasons inclusive of winter, the oranges, they are not cooling as well, but rich in vitamin C. So you need to take fruits in your diet as well. And of course, today's moms are encouraged to also take in vitamin pills. That is to prepare your body for wear and tear. Should you go through labor, the wound that you have, that is the episiotomy wound, you need healing process, all right? And then with all this, mommy, when you eat well with high protein diet and plenty of fluid, you will expect good milk coming in.
Yes, I think that's such a good point, Sister Lilian, because I think especially in our culture, we're surrounded by so much good food too, right? So not surprising. I think for me, I know the main culprit was durians. Yeah, to the point I had my gestational diabetes. My husband, he's just near here now. He would drive me to Geylang to wind down the window and put my head out so that I would smell the durians because I cannot eat it. It was quite miserable, but I didn't have to go to that stage. So I think just, knowing how you should be eating well and getting it from the experts' advice early on can actually prevent you from even having problems like that in the first place. So thank you so much, Sister Lilian, for sharing that.
Well, I didn't know, Dawn, that smelling the durian can satisfy your taste. That's
better than nothing.
Good suggestion and good guide to moms who have that durian crazy concept as well. All right. Okay. So don't forget, what you eat is what's going to form you and your growing baby. Okay. Then also prenatally, we need to think of childcare. What to do when baby comes along? That is the one that can sometimes give you a nightmare. I do get mommies telling me, still Lilian, I thought when the baby comes, it's a bundle of joy. But now with that baby, it's a bundle of woe. Mummies, I will guide you along how to detect all these problems so that you can cope up with them and then rectify them and have a good confinement time. All right. So let's go into our childcare now. Now, before we go further, you must know what are the problems that occur in newborns. Then only we can sort of go along with the journey. Now, hygiene is always a must, be it for mother or for baby. So hygiene is always a must. So is proper skin care for baby. Babies tend to have colic or distension in the tummy, which we generally call it wind in the tummy. And with wind in the tummy, you see your baby vomiting after feeding. That's why mummies feel that my baby is being overfed. No, mummies, if there's wind along the digestive tract, whether it's in the stomach or along the digestive tract, as the baby is left to sleep or play, that wind comes out and pushes the contents of the milk above it up. And it ends with what we call vomiting. At the same time, sometimes mummies think that I've burped enough, everything's fine, I put my baby to sleep. And part of the milk, before long, within 15 minutes to half an hour, mommy finds milk trickling from the side of the baby's mouth when baby is left to sleep on the side. Now, this is what we call regurgitation. Vomiting is literally ejecting the milk out of the mouth like melon. That is why it's very important, mummies, when after feeding, even after good proper burping, to put the baby to sleep on his or her side. Last year, in Straits Times, you'll find, I think, yes, it was last year, 3 babies found choked to death in the cot. Then when I saw that headline, I was shocked. I was thinking, how could baby be choked to death in the cot? Could mommy be feeding the baby when baby is sleeping in the cot? No. After feeding, baby was put to lie flat on their back. And should baby regurgitate or vomit, it goes from the digestive tract into the larynx. That means the breathing tube, the breathing tract, which is just next to the digestive tract. And that leads to the lungs. And that was how babies are choked.
Does it happen? So at what age does this tendency is not likely to happen anymore, Sister Lilian?
First month.
First month.
During the first month, always put the baby to sleep on the side. All right?
That's most critical.
Right. Then once babies are comfortable, an hour more, they will turn onto their back. By then, the milk would have gone down the passage. All right. Now, baby's bowels. I'll show you a picture of the meconium afterwards. The meconium is a blackish substance which baby passes within the first 2 days of their life. Then another complication that you need to know and handle and manage is baby's jaundice. Look at this little one. Definitely looks yellow. All right. That is jaundice. About 60 to 70% of our Asian babies have normal jaundice, which we call physiological jaundice, within the first week of life. Then there is a small fraction of babies who will have the other jaundice, which we call G6PD, that is glucose 6-phosphatase dehydrase. This is a shortage of a deficiency of the enzyme in the body system. Babies with G6PD jaundice live with it throughout life. All right. Now, if babies are not handled, relieved in the colic, and satisfied in the hunger, what you find is that your babies will be crying and fretful, and your babies will not be able to sleep well. we'll come to why and how to put the baby to sleep. All right. Now, care of the umbilical cord, we'll go into that. And then finally, how to manage our baby to sleep. Now, skincare, which we talk about. All right. Babies, it's quite normal to have a little bit of red throat patches or touch here or there, anywhere on the face within the first week to 10 days of life because hormonal changes, Babies, once they come out into this world, they no longer live on the placenta. So they go through hormonal changes. That's where you get certain patches here. That mummies, do not be too anxious and start buying cream to apply all over the face without proper guidance. Now, if babies have small streaks of little red patches, either here on the forehead or on the nose, cheeks, it's normal. Hormonal changes. Observe it for about 3 to 5 days. It will gradually fade away. But should it turn to something like this, this is obviously not something that you just leave alone. This looks like allergy rash. Your baby need to see a doctor, bring the baby to see the doctor. All right. Care of the umbilical cord. Umbilical cord, when newly born, it is soft and it's a stem with Wharton's jelly. In some hospitals in Singapore, you're given alcohol wipes to clean the base and then clean it upwards and discard. Now, the lifespan for umbilical cord usually lasts between 5 days for small ones, but average is usually 7 days to max 2 weeks. If the umbilical cord has stayed there for more than 2 weeks, 3 weeks, for example, it's not really very good, not well attended to. All right. In some hospitals, they do not do with alcohol wipes now. The survey has proven that plain sterile water with sterile cotton wool is fine as well, instead of using alcohol wipes.
I think that's just very harsh on baby skin, isn't it?
No, not really. When you are cleaning the umbilical cord, I always tell mummies, when I clean the umbilical cord, your baby might squeak a little. All right, so that you are preparing mommy mentally, but you must tell her that this is because I just came out from a warm bath. This alcohol wipes are cold.
Yeah.
So it was some irritation. That was the reason why the baby squeaked.
That's true. That's true. So, Sister Lilian, just one question. When you were talking about bathing babies earlier as well, how often then would you recommend for babies to bathe?
Babies, good question. We always recommend babies to be a normal baby born above 3 kgs or above 2.5. Ideally, should be bathed twice a day. Once in the morning for proper cleaning and once in the evening just to comfort the baby.
Okay.
But if the baby is anything below 2.5, a small size baby, maybe for the first 2 weeks or 1 week, you just do a sponge down in the evening. Okay?
Okay, thank you.
All right. Let's come now. If I am not being bulked well and I'm not comfortable, how do babies communicate with you? Mummies, the only way they can communicate is by laughing, smiling, and crying. Always, when baby cries, pick your baby up. Don't go around rocking the baby around the whole house. Then that poor baby would be brought up in an ambience of like being treated in jailhouse room. But carry the baby up and talk to the babies. Don't forget, you have been talking to your babies, communicating with your babies. Your babies is so used to mommy's voice. Just look at the baby straight in the face, about 12 inches to 14 inches away from you, and ask your baby, yes? Slowly you go. That is a very reassuring acknowledgement. All right. When somebody walk past you and you call out that person's name, that person is going to stop and turn around and ask you, yes. Same applies to babies. All right. So draw the attention. So once baby get your attention, baby will pause. And when the baby pauses, you can talk to the baby. Don't shoo and shoo the baby all along, because the more you shoo, especially without a mask, your saliva might even go to the baby. Okay? Now, so communicating is important. Could the baby be hungry or colicky? Hungry, I'm due for feeding. That's why, mommy, how to tell you? I cry. That's how they communicate with you. So you got to look at your feeding schedule and see, have you missed the feeding schedule? Or is it time to increase the feed for your baby? All right. Colicky, in doubt, always sit the baby up and burp your baby. Now, in books, it says when sitting the baby up at 90 degrees angle, all right, fall forward 10 degrees. 90 degrees angle, that's perpendicular, then fall forward 10 degrees. I will always tell moms, fall forward 2 inches. Because if I say 10 degrees, mommy will wonder, how do I go? How far is 10 degrees? You say 2 inches forward. That means it will compress on baby's stomach. Do not burp your baby sweeping up, because the stomach has a very fragile covering, the stomach sphincter. But if you keep sweeping up, you will get a merlion in your hand. Burp your baby direct on the tummy, cup your hand, so you are using air to hit the baby. All right? Give it about 8 to 10 times. Sometimes I see moms does it perfectly. My British tutor used to say, just remember, burping is P and P. The correct positioning of the baby, apply the right pressure. So when I hear the mommy doing it perfectly, and by 8 to 10 times, I say, okay, mom, continue feeding. Then mommy would tell me, hey, I didn't hear the sound. Mommy, if the air is below the stomach in the large and small intestines, you will never hear that sound. But baby will fart. But that, now, good. Now, is your baby overrest? Asians like to overrest the baby. Warm room, windows closed, fan off, aircon off, and then long sleeve. Of course, it's not comfortable. All right. So look at your room temperature. Open the windows, let it ventilate. Or even if you can even put it in aircon room, your baby's in aircon room, but with aircon, please make sure that the aircon is at 25 degrees Celsius, not 23 and 24, a bit too cold for babies. And give baby a light covering, okay? Wakeful babies. Why are babies wakeful? I do get moms who tell me, my baby doesn't cry, but don't know how to sleep. Then I will ask mommies, how much milk are you giving to the baby? Then I feel mommy has shortchanged. You have not given enough. Babies waking up, thinking and looking at you and say, mommy, where is my extra? Okay, so these are the signs. You read from babies, then you get to understand them.
Yeah.
So let's come to the stools, the types of stools that we're talking about just now. Oh. No, we have the types of stools.
Here it is.
Okay. All right. I thought never mind. Baby stools. All right. The first 2 days is that blackish meconium, as I mentioned to you. But by late day 2, it should be dark greenish to mustard. And by day 3, it should be mustard. This is how the stool changes. Got that now? All right. Then once you manage to track down all baby's problems, then you can put your baby to sleep comfortably.
So, Sister Lilian, if a
Yes.
baby is not having enough milk,
Yes.
for whatever reason, does that affect how soon or how much later the meconium will come out?
Yes, if babies has not enough milk, all right, or underfed or short change, the term I always love to use. Now, not only the meconium, the baby's jaundice will escalate. I'm going to touch on jaundice now and we'll see how they are related. All right, good. Now, some babies vomit after feeding. As I've just mentioned earlier, you moms should be able to tell me, how does vomiting occur? No burping in between, and also wrong act of burping. All right. Now, another common problem in babies during the first week of life, from day 3 onwards, jaundice always takes place. In Asian babies, 60 to 70% of them will have what we call physiological jaundice or the normal jaundice. This is because the red blood corpuscles break. And in the red blood corpuscles, this yellowish fluid, which is called serum bilirubin, runs in the whole body system. And with that, what happens when it runs in the body system? It gives the coloring of the skin. That is normal jaundice. But G6PD jaundice is different, yeah? No treatment. I will ask later if Eric would share us if there's any from TCM, but Western medicine, we monitor G6PD closely. Should the jaundice not be controlled, that keep going up, then the baby might need to go under light treatment. All right. You have to prevent infection also. In babies, we have to think of preventing infection. This is by making sure that there's hygiene. Bottles are whether you are breastfeeding or bottle feeding, they should be properly sterile. Any allergy is always noted. This is a regurgitation, as you can see. So once jaundice is controlled, you can observe and make sure that the jaundice does not escalate. Otherwise, it can affect the brain development. Okay. So anything regarding the care of newborns? If not, I will go into the postnatal and confinement myth. All right.
I think, Sister Lilian,
Yes.
well, there will be a lot of questions that will come up in the Q&A where we're consolidating them. But just one quick question about the environment. And you said to keep try to avoid the air conditioning, right? So
Yes.
when you use the fan, like for parents, is it ideal to direct the fan at them, or what's the best method to keep them cool?
No, it's all right to use air conditioning, but air conditioning must not be too cold.
Too cold.
All right, 25 should be fine.
Okay.
But if it's a nice cool day, open the windows, let the natural breeze comes in. All right.
All right.
Now, then I answer your question, Dawn?
Yes,
Good.
thank you.
All right. So now that you have managed your babies, what's the 2 pictures of the baby? All right. We will talk about our postnatal myth. That is something that we hear from many moms that read from all the internet. All right. Never tell us whatever it is, mummies. Back to you again. Hygiene is a must. So even post-delivery, you need to make sure that you take your bath. Our Asian concept, confinement cannot bathe. In those good old days, when I first joined nursing, 50 odd years ago, mummies don't bathe for 1 month. And when then they don't bathe for 1 month, what happens? Infection sets in. Infection sets in. If you have a normal delivery, the episiotomy wound, the wound below your vagina, is not being kept clean and proper. And then if you're C-sec, also it's not well treated. So all these infections that see, mommy gets fever. All right. So back again to your diet. This time around, postnatally, you must eat well. Rich in protein. Why? Prepared to replace the replenishing of your body that has gone through all your strength, your effort that you have pushed out that baby. Like I say, pushing out the tractor, all the care that you've gone through. So fruits and vegetables will come in beautifully to avoid constipation. Water, yes, Asian concept is always no water to be taken during confinement. Okay, must be warm. Ideally, mummies, I always tell them to take 3 liters of liquid a day. I would not say 3 liters of water. I frighten my mummies off to say that I drown them. 3 liters of liquid. Why? If you're talking about giving the baby breastfeeding, that breast milk by baby, the day baby is day 4 will take you about 1 liter plus. And then confinement mommy goes to the washroom, she loses about 1.5 liters of urine. If you do not pump in liquid or fluid, you will never get milk coming out. All right.
Especially since our environment is so hot.
Yes, and you perspire.
Yeah.
Then you don't have enough liquid and water, but you take alcohol. Our Asian concept, have to keep yourself warm. Have to keep yourself warm during confinement. All right, so alcohol to go in. What happens? Everybody, the whole body gets heated up. Then when mommy is breastfeeding her baby, she perspires. Then mommy's complaint is that last 2 days in the hospital, my baby drinks, sucks well. But today, since I come home, my baby refused my breast milk. Baby will also look at mommy and say, mommy, your breast milk now is a bit saltish. Because mommy has kept herself so warm, she perspires. So when baby sucks from the breast, baby is also sucking mommy's sweat. Understand? So that has to come in.
I think the alcohol also does dehydrate the mom, right?
Alcohol, ideally tea and coffee. Alcohol should not be taken, neither so is tea and coffee because of caffeine. These are the items that will reduce the milk production as well. Okay. Now herbs. From TCM, there may be some herbs that you can take during confinement. In fact, things like Elixir Anglica, all right, tangkui. It used to be a well-known good herb for confinement, but why we are not? You can still take it, but minimally, because it has estrogen, and that will reduce and affect milk production as well. TCM has some medication, some herbs that are all right, fine for confinement. Even in their bath, I have seen mummies bathing and using all these TCM herbs to bathe, and they have no skin allergies, you see. So moms are usually advised, if you do sense any allergy, then you stop using it. That's all. Maybe on this, our brother Eric can also highlight a little to us. All right.
We do have an expert in this area, so thank you so much, Sister Lilian, for putting this up in your topic as well. Let's have our expert physician Eric to come share with us about the herbs involved with TCM for postnatal and confinement.
All right.
Hi, Dawn. Yes. For TCM, for confinement, actually we divide it into 3 stages. So the first stage, we will clear the loci, which is all the clots in the bodies, so that during this stage, it generally lasts about 1 week or so. Some may take longer, some may be shorter. But during this period, we will use a classic TCM formula. usually is the you have the 生化汤. It's a combination of herbs that helps improve the circulation and get rid of the clots and the remnants in the body. Okay, so during this first stage, we don't boost the body. Don't go for ginseng or anything that boosts, because all these strong tonics and herbs will hold the low shine. So it will affect the clearance. So during this first week, at least try not to take strong herbs, strong tonics, ginseng and all those. Okay, so it may be good. Some people say I need to boost back my body, but we have to be patient. So during now we move on to the second stage. Okay, second stage we have the recovery and renewal stage. So once you have cleared all the remnants, loci, and the clots, we need to start to repair, to mend back the body. So during this period, it is good to go for like dates, or those that improve those herbs that improve the circulation and blood regeneration, and also the slight boost in the qi. So to allow the body to recover, can take it. We can take like herbs like huang qi, bei qi, which is also good for healing and repairing of cells and tissues. And also for herbs that is like some other food tonics, you can take it. Food tonics such as those high protein, drip chicken essence, all these are good for helping in the repair and renewal of the cell. Okay, so once you have reached generally it is about the third week or so, you can start to boost your body. So all the and you boost the body means that you recover the body. You get the body, your menses back, and your body support your back, because you have been holding on to a weight for almost many months. So most of the time, sometimes you have back issues, all those. So you can go for those. In TCM, we boost the kidney, so you can go for herbs with which is like 杜仲, and also those you can take in like start to bring in a small amount of American ginseng and goqizi. All these soup are already available in soup pack in most the modern TCM establishment. You can visit some of them, and you can even seek advice from the certified herbalist or traditional Chinese medicine physician on the kind of herbs that's suitable for the body of the mother. Yes.
Yeah, I think that's so important, because like, personally for myself, a lot of the herbs and the Chinese medicine that I was given during my confinement, I only had confinement done locally for my later two. So when I was overseas, I wish I had access to speaking to an expert like yourself as well, because if not, I was only consuming what my mother-in-law bought for me, and it may not be what's best for myself. So I think it's always good to see an expert and know like what's the current state of your body, and what would be better for yourself, and then to also hear from an expert instead of just old wives' tales, right? To say, oh, take more of this, take more of that. And then the other thing also during confinement, I think one of the questions that a lot of people ask is, are there certain herbs that you should not take if your baby is suffering from jaundice?
Yes. So in general, most of the herbs in traditional modern TCM establishment, most of the supplements, they will be labeled G6 PD deficient. So we try to avoid those because there's a wide range of herbs which is too much to be mentioned here. So generally, if you buy herbs or something, go for something that is go for something that is reputable, and also that and is they sell genuine products.
Yeah, thank you so much, Physician Tan. So somebody was asking, what is the third step that you were mentioning?
Oh, third step is the boosting of the body. Yeah, so we have 3 steps. I summarize it again. First, to get rid of the loci. Then after that, renew and regenerate the body, allow it to repair. Next is boosting. This is the point where you start to boost back your body, gain back your immunity. You can start to take in like herbs that boost your strength, vitality, like American ginseng, For those who want to boost the immunity, you can even go for Lingzhi, Cordyceps, all this. Yes. And also those blackbone chicken and blackbone chicken essence is also good for repairing and boosting boosting of the body strength. Yes.
Wow.
So it's a combination of food and herbs.
Lovely. Thank you so much, Physician Tan. And Sister Lilian, thank you so much again for putting that point into your slides about herbs and TCM as part of postnatal and confinement. So there's one part that we still have to hear from you about, that is the massage, sleep and rest.
Yes. Massage, postnatal massage. Very often moms are very keen. Once baby's out, my next step is to get myself into slimming. I will always share with them this. Don't be in a rush to go into any postnatal massage. You do it only when mommy has a normal delivery, not when she had a C-section, all right? Because the wound is still there. And make sure that you get a well-trained masseuse to do the massage. Not anybody who comes in. I know there are many floating around saying that, oh, I can do it, oh, I can do it. But they literally come in with yards of cloth to bundle you up. I always call them bundling mummies up, and this literally squeezing them. Because I've seen cases whereby my mummy goes upon the couch, and when she opened up for examination, oh my God, the womb they squeeze it so hard that the womb is prolapsed and it droops down instead. So the masseuse should know how to guide the moms, what to do, how to do the breathing, how to relax while you do the massage. So when it comes to massage, please get it from a medical trained personnel to handle it, all right? And with that, mummies always look for some sleep and rest. When babies are sleeping, do not go for your phone and do texting, because you can eat the best, drink the best, but if you lack rest, it's going to affect 30% of your milk output. Okay?
Thank you, Sister Lilian. Wow, so very insightful. Even after having 4 kids, I'm still learning so much from you guys.
Thank you.
And yeah, so even if you are a many-time mom, I think there's still a lot that we can learn. Or if you are planning to have to build your family, to have a child, I think most of you were saying you're in your 2nd trimester, so you're in the best time right now to learn about all these tips and tricks from the experts. So I hope you put your questions into the Q&A box, because that's where we'll be pulling out the questions that we have for you, right? So we are going to start with the panel discussion right now. Okay, so just a couple of questions for each one of us experts right here. But I'm going to direct one more question to Eric first. Okay, so Physician Eric, is it true actually that we cannot eat raw food like sushi and sashimi during pregnancy?
Yes, raw food in traditional Chinese medicine, actually, not just raw food, raw and cold food. So cold, we know that it affects the flow of qi in the body. For what you mentioned, raw food like sashimi or this, it is actually, because it is raw, so it's actually a form of toxin to the body. Yes, so it is not good for the mom, and it may affect like issues, skin issues or other health issues that is not so good. Because for mom, you have to take care of the health. That's the #1 thing. Because when the mom falls sick, all those other medication or those, which is not so good and not so ideal for the baby in the body. So best is avoid toxin and those food that will affect the nutrition, the flow of nutrients for the mom to the baby.
Very interesting. Thank you so much for sharing that. I didn't know that was toxic. I just thought it was just cooling to the body, but learned something new. And for Sister Lilian, I guess for when babies as they are being breastfed, when they are not suckling properly, is there an ideal method to just change it around for them? How do you interrupt them properly?
Well, very often I get calls from mummies who say that my baby is not latching well. my baby cannot suck well. I have milk, but my baby cannot suck well. So I will always guide moms along, mummies, how are your nipples? Are your nipples inverted, short, or flat? If the nipple is not in nice, good shape or structure, and you put your baby onto your breast, poor baby tries to suck and knows they smell the milk. Babies today are very clever. By day 2, when mommy carry them their arms, they smell the milk, they go straight and touch mommy's breast with mouth open. They know where's the restaurant. No need GPS. I can find my food. All right. But then when the baby arrived there and the nipple is short, the poor baby have to put up a struggle to pull and suck. Understand? So by doing so, baby gets exhausted easily. In other words, baby is trying, mommy says, baby does not know how to suck. Then baby will look at mommy and say, mommy, you gave me a shallow spoon, how to take soup. So you mummies, these are the scenarios I always advise moms prenatally, always get your gynaes or your nurses to check if your nipples are in good shape. If they are short or inverted, they can be corrected prenatally. In the market, there are good tools now that can really shape the nipples. I have mom whose nipple is barely visible, and only within 20 minutes, I shape her up. And mommy look at me and say, wow, it can be done like that. And the biggest joke is next she asked, is this supposed to be normal nipples looking like that? Then I look at her and say, mommy, you mean to say you don't know how normal nipples should look like? All right. So it's not always baby. It is also the shape of the nipples. You have to correct it. Then next, supply. So mummies, from 37 weeks onwards, please massage your breast. Next week, tomorrow, Dr. Wong will talk about and show you the art of massage. Because when you massage, you are stimulating the breast. You are sending to the breast the message. Hey, there's orders for supply, so got to get raw material ready.
Wow.
Okay.
So prepare earlier.
Yes, you got to prepare at 37 weeks. Okay.
Yeah. Thank you, Sister Lilian. Okay, so there's a question here from Kai Ting. Thank you so much for putting it up. The question is, I'm currently in my 3rd trimester. This question is directed for Dr. Damien. Kai Ting is currently in her 3rd trimester and has GD. How can she enhance or improve her gut health to prevent future GD issues? And does eating probiotics help?
It's a good, interesting question. So number one, you need to listen to your doctor, and your doctor has probably already prescribed a diet for you to follow, which is usually the intervention. So that's really key to follow that diet and adhere to the diet, and that will help you to kind of push the course back to less GDM. Actually, the issue with GDM is the risk factors, actually the underlying mechanism or why GDM occurs in certain individuals is not actually known. So they have ideas about why, maybe it's obesity, maybe it's the certain foods that people are eating, but there's no kind of clear and cut answer as to why people develop GDM. If you've got it in your current pregnancy, it means that you're probably in a higher risk group for it recurring in the next pregnancy. So you need to kind of just tell your doctor that's the case. So that's the challenge, and especially for first-time mothers, there is really very little signposts to indicate whether somebody would be at risk of developing GDM or not. So that's where I think the microbiome prediction is probably an added tool that we can use to help the doctors to help you.
Thank you so much, Dr. Damien. And the next question I have here is for Physician Tan. So Physician Tan, do you think it's okay to take confinement tonic and wine as part of TCM for confinement? What's your take from a TCM perspective?
For what alcohol, I think is just is a liquor, beer, all these those that is not beneficial, we don't take. It's for pleasure, for enjoyment, we don't take. Sometimes a bit of so for confinement wine, or in the form of ginger wine, or those which is treated. It's fine in moderation, and it helps the body get rid of the wind, because for moms who has just delivered, the body is very weak. So wind from outside can get into the body easily. So in order to expel this, some amount of this ginger, I mean, because they are infused with alcohol to improve the expelling efficacy. So this, a bit of it will do, but do not take when you are breastfeeding. So you can take it probably not 3 hours before the breastfeeding. And let's remember, everything is must be in moderation. Or you can speak to your physician or your nannies or those experts on this, on whether to consume it.
Okay, thank you so much for that, Physician Tan. So earlier on, Sister Lilian was talking about colic, right? And she explained about how we can actually help babies who have colic. But what about from a TCM perspective again? Is there anything that TCM can help with babies who suffer from colic?
For colics, first we must understand that babies, the organ system are underdeveloped, not yet developed. Especially for this instance, it is the heart, the liver, and the lungs that is more involved. In traditional Chinese medicine, Tcm, the heart controls, it is the conscious of the baby, while the liver controls the emotion, and the lungs is the most external part of the body. And it is so-called, in traditional Chinese medicine, it is linked to the skin. So whatever happening around the baby or the baby's surrounding affects the baby the most. They are very sensitive to the happenings or disturbance around. Therefore, they cry. Sometimes when they are frightened and all this in the body, this may develop and becomes like phlegm and wind in the body. So in traditional Chinese medicine, we need to get rid of this unnecessary wind, which is and phlegm, which is the foam in the body, which may cause this disturbance and discomfort, and therefore the crying. And we use herbs like 蝉蜕, 钩藤, and 防风, and those板南星. All these are readily available in a supplement form. You can get it from modern TCM establishment, and speak to the traditional Chinese medicine physician or herbalist on the recommendation to this.
Thank you so much, Physician Tan. So yes, there's still things that can be done from a very natural way to help your baby if he or she is suffering from colic. But you have to go and speak to the experts, yeah? Don't try and just go and buy it off the shelf. And then one question right here, this is directed for Dr. Damien. Someone was asking, because many of you actually put anonymous, I wish we could credit the questions to you guys, but thank you for putting it out though. The question is, does our diet and do our activities before delivery, before baby is born, actually affect the microbiome of our baby? Like the activities that we do and our diet, does it affect the microbiome of our baby?
So that's a really nice and interesting question. So I think, so the way I would answer that personally is I think it does, because it affects your health, and the healthier you are, the more capable you are of managing that pregnancy journey, and you do pass on microbiome in the end to your child. So I believe that if you live in a healthy environment, if your family is living in a healthy environment, and that's associated with your microbiome, if your microbiome therefore is healthier, I think your baby would derive a benefit from that. If it's only that you're a healthier individual, that's a positive in itself. So yes, and we have a lot of information on our website, babypass.health. So please do check that out, and maybe that will answer a lot of the questions that I see people are asking in the Q&A list.
Thank you, Dr. Damien. So we're going to take 3 more questions. All right. So first one up next is for Sister Lilian. So earlier on, you talked about the sleeping position for baby, right? And trying to avoid sleeping on the back, especially if baby has not been burped properly. So by sleeping on the side, is that recommended? And is there an ideal or better position that you would recommend for babies to be sleeping?
All right. Thank you for the question. Now, babies ideally should be put to sleep on their side. As I've mentioned earlier, some babies will regurgitate, especially if they just take the last mouthful of milk and then did not swallow it. The milk is collected in their mouth. So when they are asleep, the muscles are relaxed, that milk will regurgitate. So if the baby have been on his or her back, that collection of milk would go backwards, flow backwards, and might not remain in the esophagus, but go into the larynx. And this is how babies are choked. So too, same theory applies to vomiting as well. If the babies are on the side, any vomiting, it would just flow out. It would not flow backwards.
Okay, thank you so much, Sister Lilian. I think there was another, it's just a continuation from what you were talking about earlier as well, about the burping. There were quite a few people asking, like, can you demonstrate once again the ideal burping, the best burping technique?
All right. Assuming that this is the baby's head, my face is the baby's head, all right? And that's the baby's body. Baby seated on your lap should fall 10 degrees or 2 inches forward. Just try bending yourself forward by 2 inches. You find that you compress your stomach. Then with your hands, cup your hands and hit the back of the baby. Because when you cup your hands, you're using air to hit the baby, not your adult muscle. If you use a flattened hand, it is painful. And by doing so, you target the baby's stomach, and any wind in the stomach or along the digestive tract will be released. But if the wind is all the way down below the stomach in the large and small intestines, as you burp, the pressure will go downwards and then push the wind out, and baby will fart or pass out gas. Okay.
Thank you so much, Sister Lilian.
You're welcome.
Next question up for Physician Tan, our last 2 questions, all right, about cold drinks. I think you hear this so often. Can you advise, like, is it not ideal to drink cold drinks? And is warm water better, room temperature better? Can you advise us?
Yeah, I understand that Singapore's weather a lot of go for very chilled drinks or cold drinks. But the best advice is to like take it. If really cannot take it, you just take a normal room temperature water. And if let's say once in a while, let's say you go for social gatherings or what, once in a while it's okay. Just like a bit like just keep it to yourself, so called. But don't take it for like always, often, because especially when in the morning when you just wake up, this is very, very bad for the stomach. So sometimes you have that bad gastric in the morning. Because it's because all the body is like in a resting motion. It's not moving for a few hours, can be up to 7-8 hours of when you're sleeping. So when you first move, the body is not ready. It's still in a so-called cold state. So you need to activate it. So you need a bit of warm water. So if you drink cold water, especially early in the morning, you will cause this tightness, especially in the stomach, with an empty stomach also. Yes, so it will cause the stomach to squeeze and it's contract and leads to a bit of pain, all those. So I would say that for cold drinks, especially for women or ladies with menstrual cramps issue, try to not take it at all. It will worsen the cramps. Yes, for those with like normal menses, menstruation, or normal body condition, you can take it like just take it once in a while as so-called like we stealing something, like we are stealing something. Yes, just hide it. Oh, I didn't. Yes. Not to take it frequently, like say every hours, every meals.
Yeah, it will have an effect on the body. Yeah.
Yes. You may not feel it now, but over a long run, or when you grow old, gets older, the circulation gets poorer, and all the problems will start to come up. Yes.
Okay. Thank you, Physician Tan. And the last question is for Dr. Damien. Interesting question. So for people who suffer from existing skin conditions such as eczema, urticaria, or psoriasis, does this affect the microbiome which passes on to the baby?
So the microbiome definitely on the skin is affected of the person that has that condition. That's for sure. And I guess I'm not aware of a direct study that has actually looked at to answer that particular question. It's a very specific question. But I guess the way I would answer that is the environment always gets shed onto the baby. So it does kind of influence, but I don't think there's a direct link between those particular conditions and your baby. And honestly, I don't think we should alarm that individual that you can handle your baby and everything should be fine. So yeah, I think the best course of action is consult your physician. That's the number one advice, I think.
Thank you so much, Dr. Damien. And thank you so much, everyone, for your very good questions, very insightful questions as well, that we can all learn from. I'm sure, if you didn't ask it, we didn't even think about it. So we're all really learning together. And I do hope that you're learning more by signing up for the upcoming webinars that are happening as part of the Singapore Parenting Festival as well. So with that, we are ending the panel discussion. And please do not forget to scan this QR code if you missed it out earlier. So only the first 150 attendees for today are going to be able to receive the goodie bag, right? So you just have to fill in your information and redeem your goodie bag while stocks last, all right? So we will also be announcing the winners very soon. But first off, I would like to thank once again the Platinum partners, Hydroflux and Yirensen, for making this event possible, together with the Gold partners, Dumex, Scott's, PCF Sparkle Tots, Nature One Dairy, the Silver partners, Ministry of Health Singapore, Baby Dove, Virtus Fertility Center, Prudential, the Content Partners, Center for Fathering, Mums for Life, Dads for Life, and Baby Pass, and of course, MediaCorp and the Asia Parent for creating these exciting webinars that everybody can learn from. And I'm really looking forward to hearing more about what the later webinar specialists, expertise, and whatever sharing that they have that can help us make our parenthood, motherhood, fatherhood a whole lot easier and more enjoyable as well. All right, so with that, we're gonna announce the winners of the $50 shopping vouchers. Congratulations to Tan Chun Hao, Jason, Li Qing Eng or Eng Li Qing, Yvonne Xiao, Keegan Kang, Vyabavi Shah, and Nasuha Nasir. Congratulations to the 6 of you. Please claim your $50 Shopee vouchers by sending an email to campaign@tickledmedia.com together with your name, your contact number, and within 3 working days to claim your prize. And then you can go shopping. All right. So thank you so much again, everybody. And of course,